It's actually seborrheic dermatitis is actually a yeast overproduction of yeast.
Okay.
Yes. And sometimes in babies, about on the first few days of life, meron na talaga sila.
Yeah.
Mm. Dumi. Hindi po yun dumi, mga mommies. So,
Mom, Dad, it is important that you know how to take care of your baby's skin. Are you wondering how to do just that? Is your baby suffering from a scaly rash on the scalp? Or, dry, red, itchy skin on the body? Do you live in a humid area and you note that your baby has red bumps with tiny blisters on the skin? Are you worried about your baby's diaper rash? In this video, we will talk about the common skin condition in babies and children. Join me as I interview Dr. Odette Alonzo, a board-certified dermatologist. Hey everyone, I'm Dr. Kristine Kiat, and this is Chat with Peds, where I interview experts in the field in order to empower you and give you the confidence to raise happy and healthy kids. My guest is my good friend and colleague, Dr. Odette Alonzo. She is a board certified dermatologist and training officer of the Department of Dermatology and Venereology at Southern Isabela Medical Center, where we first met. She's a wonderful resource for a lot of questions and referrals that I've had on children's skin problems. So join me as I welcome Dr. Odette Alonzo. Hi!
hi, Tin. Thank you for having me.
Yeah! All right. Another common problem that we always see is cradle cap or seborrheic dermatitis. So what is
Yes.
it really?
It's actually, seborrheic dermatitis is actually a yeast overproduction of yeast.
Okay.
Yes. And sometimes in babies, about on the first few days of life, meron na talaga sila.
Yeah.
Mm. Dumi. Hindi po yun dumi, mga mommies. So, stop stressing about it. Hindi po yan dumi. So, it's an overproduction of the normal yeast.
Mm,
It can be very common yan na makapal, di ba? Parang very greasy na
yeah.
flakes in the scalp of the babies, of the infants. You can also observe it dito sa forehead nila, in between the eyebrows,
Yeah.
the ears, sa nose, sa
Mhm,
folds.
mhm.
Mm-mm.
Okay.
So, hindi po yan dumi.
Is it the
Relax
same as
lang.
eczema? Eczema din ba yun? O iba?
It is a form of eczema.
Ah,
It
okay.
is also a form of eczema. Mm-mm.
So, what do you tell parents? Like, how should they wash their baby's hair who has cradle cap?
So, if it's very thick, we usually advise them to put mineral oil first,
Okay.
massage on the scalp,
Mhm.
bathing. So, para mag-loosen, so that when you shampoo, when you wash it, it can spontaneously be removed through the washing process. But avoid, of course, anything sa skin ng babies, avoid yung vigorous na rubbing, or do not try to take it out na minamanipulate ng pinipik with your hands. Baka lalong magsugat. Mm.
Okay. So you mentioned
So, we can apply mineral oil, 30 minutes at least before bathing para medyo magbabad. And then you can use your normal cleansers. Mm-mm.
mm,
And then probably pagka medyo malambot na, gently brush it, but gently, gently.
okay. Okay.
Mm-mm.
So when will
Gentle.
be the right time for mom and dad to bring baby to the doctor kung anong gan yung cradle cap nila?
If it's very thick,
Okay.
very thick, and pagka naging toddlers or naging teenagers na at pabalik-balik,
Oh, okay.
so
Meron
usually,
teenagers din.
yes, it can persist. It
Mm,
can persist or it can be recurrent, yes. Puwede yung mga babies kunwari bagong panganak sila, may cradle cap sila,
mm,
then matanggal na. There are also some patients na pagdating nila ng elementary, high school,
Okay.
babalik. And then it's usually associated now with stress.
Ah, all right.
Yes, especially during exams or yung mga, alam mo yun, mga medyo grade conscious na
Stress na
overachievers. I've seen a lot of patients, yung especially yung mga ano, nape-pressure.
may exam na.
Pressure.
Are there ways to prevent it na hindi na babalik yung sebderm?
Avoid the stress.
Okay.
Try to live, try to live, I don't know, nung bata ka ba, stress ka ba? But stress in children, especially yung mga medyo nasa high school, especially yung at the age now, di ba, we have mental health problems, yung mga ganyan. So, avoid the stress. In children, relax lang kids. Di ko alam. Kasi 'di ba when you are trying to be on the top of the class, 'yun. So kapag during exam week,
Mhm.
may project na deadline,
Okay.
number two, or may nakaaway na friend, na stress or ano mo yun, papagalitan. Ayun, yung mga ganon kasi yung mga sa bata na mga stress levels nila. Number two, also make sure that you have a really good immune system. Malakas. Because since, di ba sabi ko sa inyo kanina, ang seborrheic dermatitis is an overgrowth of the yeast.
Okay.
So kapag mababa ang immune system, they tend to grow because walang immune system that is keeping their numbers.
So parang
Diba?
parang yun na yung dandruff, 'di ba? Tama ba?
Yes, dandruff. Oo.
Okay.
So hindi siya yung because hindi ka hiyang sa shampoo.
Mhm.
Uh, Maybe, but of course there is more to that. Mm. Pag malamig din ang panahon, yan, very common na tutubo. Alam mo naman dito sa Isabela, Quirino,
Yeah.
December, January, February. Yeah.
Yeah. True,
Mm,
malamig.
Malamig.
Oh, thank you so much, Odette. Those are very helpful advice. For
You're welcome.
parents who would want to reach you, how can they reach you? Where do you hold your clinic?
So I hold clinic here in Maddela, Quirino, and at the Adventist Hospital. If you want to look for a board-certified dermatologist, you may also look for the nearest dermatologist in your area through logging in at www.pds.org.ph. So you will find there, find the derma, and then you can put in your area, like region 2 or your province or your town, and then the website will bring you to the nearest dermatologist near your area.
Thank you so much, Odette.